Today, I will share a case study on a neurological topic, homeopathic management of hypoxic ischemic encephalopathy through BrainMindia protocol. Age of the patient was 3.6 years, gender male. Diagnosis: I did hypoxic ischemic encephalopathy, HIE. Duration of the treatment was 18 months. Hypoxic ischemic encephalopathy is a neurological condition resulting from oxygen deprivation and limited blood flow to the brain during birth or early infancy. Common symptoms include developmental delay, muscle stiffness or floppiness, seizure-like activity, and delayed milestones in speech, walking, and coordination. The child in this case was brought in with poor head control, delayed motor milestones, stiff limbs with occasional spasticity. Lack of verbal response, poor social reaction were also observed. Parents had tried physiotherapy and occupational therapy with limited progress before approaching homeopathic care under the BrainMindia protocol. Now, treatment protocol through BrainMindia approach. Constitutional medicines, I used Cuprum metallicum and Ethuja synapium. Cuprum metallicum 10M. This medicine was chosen for its deep action of neurological rigidity, convulsive tendencies, and nervous system imbalance. Helped ease muscle spasms, reduced neuroirritability, and improved overall tone. Besides Cuprum metallicum 10M, I had to use one more polycrest constitutional medicine, which was Ethuja synapium 200, indicated in children with mental dullness, digestive weakness, and inability to respond cognitively. Improved attention span, reduced restlessness, and helped with understanding commands. As a therapeutic medicine, I had to use Apocyinum cannabinum mother tincture, which was used to address fluid retention, muscle weakness, and neurological sluggishness. Supported motor development and neuromuscular connection. Along with those medicines, I prescribed trituration medicines Plumbum aceticum 3x, known for its brain and spinal cord action, helping in cases of nerve degeneration and paralysis. Also supported hand-leg coordination and reduced stiffness in the limbs. Secondly, one more trituration remedy, which was Ammonium valeriana 8x, had to administer, which helped reduce irritability, emotional outbursts, and promoted calmness and mental relaxation. It also used to modulate central nervous system excitation. Now, treatment timeline with observations. In the first phase, initial response received between 2 to 4 months. Noticeable reduction in stiffness and rigidity of limbs. Began to recognize familiar voices and sounds. Slight improvement in head control. In intermediate phase, neurodevelopmental progress were achieved between 4 to 11 months. Improved postural control and sitting with support. Stated crawling slowly with better limb strength. Improved response to verbal cues and eye contact. Emotional responses such as smiling, recognizing parents became evident. And in the final phase, phase number 3, functional gains achieved between 11 and 18 months. Attempt standing with support, made verbal sounds and gestures for basic needs. Emotional stability and sleep pattern improved. Cognitive understanding and attention span improved gradually. So, the outcome summary was a symptomatic relief within 4 months with reduced stiffness and better sleep, considerable improvement by 11 months with cognitive and motor progress, and treatment completion at 18 months with 50% functional improvement. What was the parental satisfaction? It was positive, hopeful about further gains. Developmental gains. Motor skills improved, emotional bonding developed, speech progress, early sounds and gestures emerged. Physical coordination. Notable progress in posture and limb use. So, in conclusion, we can say this case reflects the potential of BrainMindia protocol in offering structured, individualized care to children with neurological developmental delays like hypoxic ischemic encephalopathy. Despite the irreversible nature of the initial hypoxic insult, this patient experienced neuromuscular involvements, better emotional and social interaction, measurable developmental milestones, all achieved through gentle, safe, and holistic homeopathic care over 18 months. Thank you.